Hello and welcome to HOC TV. My name is Kelly Henry and I'm here interviewing the one and only Dr. Shroff. I'm excited to meet you today and talk to you about what you do. So tell me about you.
Thank you for interviewing me. I'm Dr. Shroff. I've been in Big Spring for 20 years. I practice cardiology and internal medicine, which covers diseases like diabetes, hypertension, high cholesterol, asthma, COPD, chest pain, shortness of breath, and what are the services we provide in Big Spring is seeing the patient, taking care of their cardiovascular health, diabetes, hypertension, hyperlipidemia, as well as we do treadmill stress test, we do nuclear cardiolite stress test, we do echocardiogram, we do heart rate monitoring, and we also do cardiac catheterization. Mostly I practice in Big Spring. 80% of my practice is in Big Spring. About 20% of the work I do is in Odessa at RMC Hospital, where I do the coronary interventions along with some of the colleagues.
Oh wow, that's great. So you do kind of everything. When you're seeing patients, what are some of the main conditions that you're seeing?
Most of my patients, they have mostly diabetes, hypertension, high cholesterol, or COPD. They have coronary artery disease, they have stent put in before, they have bypass, congestive heart failure. So most of my practice I do, 70% of practice I do is cardiology related, and 30% of the practice I do is internal medicine related.
Can you tell us the symptoms of COPD? What is that all about?
Symptoms of COPD are usually shortness of breath, tiredness, fatigue, weakness, coughing spell, productive cough, hard to breathe, wheezing. These are some of the common symptoms. In most of the patients, COPD is caused by long-standing smoking for many years. For some of the patients, you don't have to be smoking to have COPD.
Okay, so what is CHF?
CHF, as you know, it stands for congestive heart failure. It's a condition where the patient becomes short of breath, they have leg swelling, they have a little bit of exertion they get very, very short of breath, tired, fatigued, and weak. So the congestive heart failure is a condition where the heart cannot meet the body's demand. So it can be caused by a lot of different conditions. It can be caused by long-standing hypertension. It can be caused by hardening of the arteries, coronary artery disease. It can be caused by some of the medication. So it has a variety of causes which can lead to congestive heart failure. So in garden variety congestive heart failure, there is a heart pump which cannot meet the demand, or what we call systolic dysfunction, where the heart does not pump enough to meet the body's demand. As you know, there are two kinds of congestive heart failure. One is systolic dysfunction, where the heart is just not able to pump enough. Another one is a diastolic dysfunction, where the heart pumps good, but it cannot dilate properly, or it cannot relax properly. And so both congestive heart failure has different kind of treatment. So saying that, it is very important that we diagnose the congestive heart failure correctly, whether it is a systolic dysfunction or diastolic dysfunction, so we can plan the treatment appropriately, because the treatment for both the heart failure is different.
Good, well that's great. Well, that was it. Thank you so much, Dr. Shroff, for meeting today and telling us all about cardiology and what you do. Thank you all for watching HOC TV.